I've never had so much help as what I have with HomeLink. They're such nice people.
I know I can go home, hand on heart, every single day since I've worked for HomeLink and say that I know I've made a difference today. Hi, how are you?
Yeah, we're okay, Kate.
Lovely.
Come in.
Thank
Come
you,
in,
darling.
girl.
HomeLink Healthcare provide hospital at home and virtual ward services for the NHS.
So back in 2016, a group of us, many of whom had worked clinically in the NHS for a number of years, were very mindful that many people were being cared for in acute hospital beds that could be cared for at home.
HomeLink, as a trusted partner of the NHS, help with supporting the discharge of patients out the back of hospital into their homes, and this creates additional capacity within the hospital.
We're trying to support the NHS in discharging their patients and preventing patients going back into hospital.
They get a more personal one-to-one care. I think that improves their own physical and mental health as well.
Any nice plans for today? What are you up to?
Patients are cared for in their own home. That's hugely beneficial. You're in your home environment, you can watch the TV. It's just so much nicer.
We're able to make them feel safe at home and have that same quality of care at home.
I wanted to get home so much, yeah. I'd had enough of hospitals.
I was in the hospital there and they says, it's only going to be 6-7 weeks, something like that. I said, oh, hang on here. I ain't staying in here for 6 weeks, especially over Christmas. And next minute they said, we've got this HomeLink people and they're going to look after you now.
Perfect. Lovely. All within normal range. I think psychologically the support you're able to give at home is so much more valuable than being in a hospital area. You're able to focus on that patient and what they might need and pick up their subtle clues that they might give you but you might miss in a hospital setting.
And the wonderful thing about it is to see the results of how happy the patient is to be in their own environment.
You're blaming it on me. This is how I ended up in this position, Bob, I'm not going to lie.
What we do is we take into account the trust needs, what their current pressures are and what their gaps are, and really we're there to provide that solution for that.
They're a grand bunch of nurses, you know, always have a little time for you to talk to you.
It's more personal for them. They feel that they're getting the attention that they need and that they deserve, to be quite honest.
Your patients are patients' names rather than a bed number. Chance to be a fine thing.
I mean, for me personally and professionally, it's been an incredible journey. To date, we've saved the NHS over 155,000 bed days. We've got really high rates of staff retention. We want to support the NHS to be the best that it can in terms of delivering great health outcomes. And that's what I believe we've achieved over the course of the last few years on our HomeLink journey.
Commissioners choose HomeLink because of our versatility we can bring to any service.
That was really down to them to sort of look after me the best they can, and they have. I'm pleased all round with them.
The job satisfaction for me comes from me giving a little bit of me to somebody else.
I just think HomeLink are brilliant, to be quite honest, and I don't care whether that's on camera or not.
Definitely take them on and let them look after you. And they'll do it at your pace, not anybody else's.